High blood pressure, hypertension, is a serious condition that can affect anyone. Every time your heart beats, it pumps blood to the rest of your body through arteries. Blood pressure is created by the force of blood against the artery walls. If it is consistently too high, it puts extra strain on your heart and blood vessels. This may increase your risk of a heart attack, heart failure, stroke, and other conditions including kidney disease and dementia. Sometimes high blood pressure is caused by another health problem you already have. But most of the time there's no obvious cause. Certain things are known to increase your risk of high blood pressure, including being overweight and not eating a healthy diet, or having a relative with high blood pressure. 3 out of 10 adults in the UK have high blood pressure. You're more likely to develop it as you get older. High blood pressure has few obvious symptoms. But it can be identified by regular checks and treated through changes to your lifestyle as well as medication. Hypertension does not always cause symptoms, which is why the condition often goes unnoticed. However, there are some signs and symptoms of hypertension, that is high blood pressure, to watch out for. Often, people do not recognize the signs of high blood pressure until they have a stroke or heart attack. High blood pressure is known to be a silent disease that often does not produce obvious symptoms. It is recommended that you regularly check your blood pressure to make sure you spot a dangerous increase early on. There are, however, a few symptoms that occur in people with very high blood pressure. These include chest pain, lightheadedness, shortness of breath, tiredness, and vision troubles. The symptoms of high blood pressure. Let us start with a bit of information on blood pressure and hypertension. When your heart pumps blood through your body, this increases the pressure in your arteries. Normally, they respond by widening. High blood pressure happens when your arteries have hardened, due to aging, diseases, or an unhealthy lifestyle. Hardened arteries do not relax sufficiently. As a result, your blood pressure increases. In other words, your arteries remain relatively narrow even when you have a lot of blood flowing through them. Over the years, the increased pressure on your arteries damages them as well as your heart. Eventually, high blood pressure can lead to stroke and heart attack. Symptoms of hypertension. Hypertension does not commonly cause symptoms. However, in some cases, the following symptoms can occur: chest pain, vision problems, tiredness, headache, nausea or vomiting, pale skin color. These symptoms can indicate that you are having a stroke, in which case you may also experience shortness of breath or difficulty breathing, ringing or buzzing in the ear, confusion, severe headache. These signs and symptoms of hypertension usually occur when patients are experiencing a crisis or an emergency because their high blood pressure has reached dangerously high levels. These signs are also common in people who suffer from a sudden increase in high blood pressure, accelerated hypertension. If you experience any of these symptoms, seek medical help immediately. Hypertension statistics. Around the world, hypertension leads to more than 8 million premature deaths each year. There are about 62,000 people who die prematurely each year from strokes and heart attacks as a result of high blood pressure. An estimated 7 in 10 people have increased blood pressure, and the condition increasingly affects younger people, too, nearly half of the population under 35. What these hypertension statistics also show is that most high blood pressure patients, about a third, are not actually aware that they have the condition. This is primarily due to the fact that most of the time, high blood pressure remains symptomless. Unaware of the condition, patients continue with an unhealthy lifestyle that puts them at risk of stroke, diabetes and other cardiovascular diseases. For this reason, high blood pressure is sometimes referred to as the silent killer. Medical signs of hypertension. The easiest way to find out if you have high blood pressure is to take your blood pressure reading. Measuring your blood pressure is very simple and painless. It is carried out with a device called sphygmomanometer, the inflatable cuff that your doctor puts around your arm. Within seconds, your doctor can measure your blood pressure. The results work like this. Anything between 120/80, 120/80, and 140/90, 140/90, is dubbed the pre-hypertension stage, which often leads to hypertension. Between 140/90 and 160/100, you are in stage 1 hypertension. Between 160/100 and 180/110, you are in stage 2 hypertension. Above 180/110, you are in stage 3 hypertension, and you need immediate medical care. People in stage 3 hypertension tend to suffer from secondary hypertension, which is a form of high blood pressure with known causes such as kidney disease, hormonal disease, for example gland tumor, hyperthyroidism, lead poisoning, head injuries and pregnancy. Other signs of secondary hypertension include no effect from high blood pressure medication, even if it did work before. Suddenly high blood pressure. No history of hypertension in your family. Be it primary hypertension, the most common, or secondary hypertension, it's very important that you consult a doctor for high blood pressure. This is the only way to understand what type of hypertension you are suffering from and which treatment is best for you. Early signs of high blood pressure. Patients who experience early signs of hypertension usually complain about dull headaches, short moments of lightheadedness as well as unusually frequent nosebleeds. It is quite rare for blood pressure to cause symptoms in the early stages of the condition. Signs of stroke. High blood pressure can lead to dangerous emergencies such as stroke. As soon as you recognize one of these symptoms, you must seek medical care immediately. Call 999 in the UK if you or any person around you has issues speaking clearly and understanding someone else. Cannot use his/her arms, for example dry raising them. Suffers from facial weakness, for example drooping eye or mouth, inability to smile,